歡迎大家。
Welcome to today's press briefing. We have with us two speakers. They are the head of the Communicable Disease Branch Center for Health Protection, Dr. Chang Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Gladys Kwan. Dr. Chang will give us information about update on cases, and Dr. Kwan will give us information about the HA. Currently, there are 1,411 patients that have been admitted. 179 of them are new cases. Those who are in isolation facilities, 440 of them are in isolation ward, and 58 of them are in the second-tier isolation ward, and 432 of them are in the North Lantau Hong Kong Infection Control Center. 141 of them are new cases. Yesterday, we have new cases, 9 who are in a critical condition, 5 in a serious condition. Currently, those who are confirmed and staying in hospital, there are 21 of them that are in a critical condition and 18 in a serious condition. 10 critical patients are in the ICU. Yesterday, we mentioned about patients in a critical condition. There is one girl who is a 22-month-old. The situation is still critical. The Eastern Hospital will continue to monitor the situation and provide suitable treatment. Yesterday, we were asked about the time of admission for the baby girl. We found out more information. The day before yesterday, the girl started to develop a fever. The family members took her to North Lama General Outpatient Clinic to seek treatment. The HA staff has been liaising with the Eastern Hospital for emergency services, and helicopters took the baby girl to North Lantau General Outpatient Clinic. We also have 5 new death cases, 4 males and 1 female, aged between 55 and 88. One of the cases came from care home. Only one has completed the course of vaccination, that is 3 doses. Of the 5 death cases, that includes the first being an 88-year-old male suffering from cirrhosis, had a stroke, and bedridden without the ability to take care of himself. On the 5th of July, because of hemorrhage as well as abdomen pain, he was admitted to hospital. We found that there was obesity in his X-ray, and he was sent to the A&E department, and he had a PCR positive case. The other one is a 61-year-old male suspected of lung cancer. He was found unconscious at home. When he was sent to the A&E, he had already passed away. Afterwards, we did an RAT and confirmed that it was a positive case. The case was referred to the coroners. The third case is an 86-year-old male. He had hypertension and a high blood lipid fat. And on the 20th of July, he was admitted to hospital. It was a positive case, and which he's been prescribed with oral medication. He had pneumonia, and his condition deteriorated and passed away. The other one suffered from lung cancer and is receiving hospice services. The cancer spread to his hand, and he was on palliative care, and his lung condition improved. However, the cancer condition at his hand caused inflammation, causing multiple organ failure. In the end, he died. The last case is a 55-year-old female. We suspect that it was a case of falling from height. When she was admitted to the hospital through A&E, she has already passed away. We conducted an RAT and found that to be a positive case. The case has been referred to the coroners. In the past day, we have 147 patients who have recovered. 136 patients have been discharged. 5 patients were found to be positive during admission, screening, or when tested in the hospital. 17 patients in the same ward and staff members are classified as close contacts. We have 25,954 patients that have been confirmed in the past, and 25,398 of them have already recovered and resumed duty. We now have an announcement to make. It is a cluster in medicine ward within the Queen Mary Hospital. In that ward, there is a 58-year-old male. On the 24th of July, before pre-operation testing, he was found to be positive with COVID. On the 26th as well as the 28th of July, in the same ward, we have identified another 2 cases. That is a 170-year-old male and 172-year-old male. The 3 patients are in isolation facilities. Their condition is stable. Through tracing, we found that there are 4 staff members in the same ward on the 26th of July being confirmed with COVID. For the staff members, they don suitable personal protective equipment when they work. The ward has been thoroughly disinfected. We have stopped receiving new cases and stopped visitation. We continue to monitor the health condition of patients as well as staff members. We are in close liaison with the CHP, and we will update you as necessary. The last announcement is in relation to relaxation of the use of COVID oral medication. Starting from today, we will update relevant arrangements. We aim to prescribe more COVID oral medication to suitable patients. Under the new criteria, if is someone under the age of 60, high risk, suffering from chronic illnesses, and seek medical attention within 5 days from symptom onset, whether that person has been vaccinated, we will prescribe COVID medication in order to reduce serious cases as well as fatality. For those who suffer from any symptoms, and if you suffer from chronic illnesses, please seek medical attention because the condition may deteriorate rapidly. With COVID medication, it would help reduce the risk of critical condition, serious condition, as well as to reduce the viral load, and this will also help them recover more quickly. Yesterday, we have made use of this platform to let you know that we have 7 designated clinics. We have medical inquiry support hotline, and you can also make use of your smartphone by going to the HA Go app. Make use of our remote consultation. Afterwards, you will receive medication. Private doctors will also be able to prescribe oral COVID medication. Lastly, if you have not been vaccinated, please do so. This will reduce the risk of a serious condition.
Good afternoon. Yesterday, we had 4,696 local confirmed cases, including 751 PCR positive, and also RAT positive and verified cases, 2,945. We've got 188 imported cases, 161 of them PCR positive and 27 RAT positive cases. As mentioned by Dr. Kwang, we received 5 reported cases of death. In the 5th wave, the total death tally is 9,285. Among the 181 imported cases, 79 were picked up at the airport. Another 90 picked up at quarantine hotels, and 19 of them have already left quarantine hotels. Of the 181 cases, they came from 40 cases. The following 6 places have imported 10 or more cases. UK 30, Singapore 17, in India 16, Australia 15, Philippines 15, and US 14. And then we've got 30 places importing 10 or less cases. We've got 2 care homes for the elderly and 2 care homes for the disabled with cases, and quarantine of close contacts are required. YMCA 文華護理安老院 got 1 resident confirmed. 5 residents have to be quarantined. 扶康會澤安成人訓練中心 is residential home for the disabled, 1 resident confirmed and 6 residents to be quarantined. 松寧保德護老中心 1 resident confirmed. 5 staff members also confirmed. 6 residents and 10 employees have to be quarantined. 惠蘭私家 a residential home for the disabled, 1 resident confirmed and 6 residents have to be quarantined. For schools, today is Friday, we have got 290 schools reporting 351 positive cases to us, covering 302 students and 49 staff members. In the past week, 161 schools have reported 2 or more cases to us. The remaining 3 schools have got individual classes with clusters, and then they will have to suspend classes for 1 week. Pentecost School in Kowloon City, Class 4A, 3 out of a class of 26. The Queen's College, Class 4C, 3 confirmed in a class. And a kindergarten in Tuen Mun, Class K3A, 3 out of 26 students confirmed, and then a class expansion for 1 week. In recent days, we have noticed a rising trend in the number of deaths. We would appeal to the public once again. For those who have yet to receive the 3rd dose, do so as soon as possible. Now, look at the total number of cases for those who have received 3 shots. The overall death rate is 0.004%. Not vaccinated, the death rate is 2.94%, a difference of over 70 times. Of course, many of the death cases involve the elderly. For those who are over 80, if they've never been vaccinated, the death rate is as high as 16.21%. Fully vaccinated with 3 shots, 1.03%, a difference of 15 times. So our senior residents account for most of the death cases, and they should at least receive 3 shots. So for those who are over 60 in Hong Kong, we recommend that they take 4 jabs. We have seen serious and also death cases recently. May I remind the public once again that if you feel unwell, you should see a doctor as soon as possible and be tested. And if tested positive, members of the public should declare themselves and also their family members through our online platform. We have got 2 online platforms for declaration. For those who have got a test at a community test center that is a PCR positive patient, the patient should have got an SMS informing him that he is positive, and he is reminded to upload certain information. There is a link in the SMS for declaration. The web page is administered by CHP, but the last letters in the link is cdit.gov.hk. So that is the platform for declaring PCR positive cases. We've also got an online platform for declaring RAT positive cases. That is, you have done RAT at home, and we won't know that you are positive unless you declare it to us. And the website is chp.gov.hk/RATP, so the last few letters are different from that for PCR positive, and the last 4 letters for that is CDPI. So for those PCR positive, you should not use the RATP online, because for the RATP platform, you need to upload your ID card and also the image of your RAT positive result. So we have a questionnaire, and we use that questionnaire to decide where the patient should be quarantined. And we also like to identify high-risk persons from the questionnaire. For instance, those who are 70 or above, those who are 5 or younger, those who are over 25 weeks pregnant, or those who are immunocompromised. For these high-risk persons, we hope that we can know their health conditions as soon as possible, and if they deteriorate, they should seek medical help at once. We'll ask whether they belong to one of these groups. If so, whether they can monitor their own health conditions at home. For instance, if they have a nurse at home, and of course there will be someone to monitor his condition. But if we are talking about a person living alone or family members who cannot monitor his health, then perhaps going to a community isolation facility is safer. And for people not within these high-risk groups, we'd like to know whether they have high-risk family members living together. So if they have a family member who is among one of the 4 high-risk groups, because if they live together in the same flat, it may not be able to have separate bathrooms or living area. Now, if high-risk family members cannot live separately from the patient, then I hope the patient can go to a community isolation center, or family members can go to a community quarantine facility, or they may be living in a subdivided unit. We'd like to know whether there is a separate bathroom or separate room for the patient as well. If these do not exist, there is the possibility of infecting family members, in particular if they are high-risk groups. So these people should better go to community isolation facilities. After filling out the questionnaire, we will triage according to the information provided to decide whether the patient should be quarantined or isolated at home or at a community facility. So I hope members of the public can read the questions carefully and do not miss out any information. And if a person is triaged to a community isolation facility, the person should follow suit to lower the possibility of serious condition. And when filling out the questionnaire, if there are already warning signs, then the person should attend an A in the department. For instance, after taking fever-killing fever medicine, the temperature is still over 35.5, or if the body temperature is lower than 35 degrees Celsius, or if there is seizures or difficulty in breathing, unable to remain conscious, or chest pain, abdominal pain, and a marked deterioration in the level of consciousness, fetal movement has stopped or reduced, etc., and unable to eat for a long time, diarrhea, and vomiting for more than 2 days, both the patient and family members should beware. The patient should attend an A&E department as soon as possible and should not stay home.
Now the floor is open for questions. Before you ask questions, introduce your media outlet. The person in the middle towards the end. I'm from Now TV. I'd like to ask about oral medication. Is it the case that if it's a positive case, where whether that person suffering from any symptoms, they can get the medication, or do you advise them to go to designated clinics or do it via HA Go? I'd like to also ask about the 4th case of death. Lung cancer. What's the age of the patient? Because you did not mention it. The Health Bureau talked about a mirror case. They said that, well, they would allow family members to not go through quarantine to visit the person in the accident. What was your consideration? If in the future there are similar cases, would you arrange for special arrangements? Let me first answer you. We have compassionate arrangements in place all along, because for some emergency situations, family members might need to fly back to Hong Kong. We would try to accommodate them as much as possible. Under the new arrangement, those under the age of 60 with chronic illnesses and high risk, whether they have been vaccinated, if they have symptoms or if they have mild symptoms and seek medical attention within 5 days, we will see whether there is any contraindications before we prescribe the medication. For those above the age of 60 with symptoms and whether they have been vaccinated, we will prescribe oral medication. As to whether they go to the designated clinic or use our remote consultation service, it depends on the situation and the need of the patient. If it's done remotely, that means the patient doesn't have to leave their home. After the consultation, medication will be delivered to their door. In this way, we will reduce circulation of positive patients in the community. That's why we encourage members of the public to make good use of this method. What did you ask about the fourth case? It's a male patient, 75 years old. The one at the back towards the right. I'm from cable TV. First of all, about oral medication. My question is, there are 2 available oral medication. What's the utilization rate? You talk about relaxation of its use. What's your estimate about the increase of use of the medication? Of the Queen Mary Hospital cluster, what's the source? The staff members, 4 of them, did they work in the same ward? Have they had meals together? Private clinics said a few days ago that they will be able to make available about 300 beds or so. But in the past few days, we have over 4,000 cases per day. When do you think that you would need to use the beds available from the private sector? I will first answer questions about medication. As at the 29th of July, we have altogether prescribed over 40,000 doses of the oral medication. 21,000 of them are Malupiva, and over 17,000 of them are Paxlovid. We have relaxed at the criteria because we think that we still have stock. So we're not worried that we will run short of the medication. In relation to the medicine ward cluster at Queen Mary Hospital, the 4 staff members work at the same location. But so far, we have no information about whether they have gone out and had a meal together. There are quite a number of confirmed cases in the community. We're still trying to find out whether the source of the infection is in the community. Regarding the beds in the private sector, we are still in discussion with the private sector. The low-fee beds mechanism is still in place. When we have suitable patients, we may make use of this category of beds in the private sector. We will work with the private sector. We will select patients who are in need. Say, for example, they have to be on certain medication for a short period of time. We may refer them to private hospitals. There is not a fixed date by which we have to do certain things. The most important thing is to make optimum use of our resources to help those in need. Next, the one in blue at the front. I'm from TVB. I'd like to ask about the Queen of Mary Hospital cluster. What's the condition of the other patients? The other question is in relation to monkeypox cases in the Philippines. Would you enhance the declaration requirements of arrivals? We'll monitor the situation in relation to monkeypox cases. There is an incubation period and a rather long one for monkeypox. So if you are a close contact, or if you've exposed to a risk of infection, you have to monitor your situation and tell your doctor. We write to doctors and give them reminders to let them know the latest situation. According to the WHO, the monkeypox may not appear all over your body, but may be localized at a certain part. We will let them know. For the Queen Mary Hospital, it's the medicine ward. The other two patients are male patients, one 70 years old, the other one 72 years old. The one towards the right in the middle.
So about the COVID drugs, who are the new groups of people that will be eligible for the drugs, and why is the HA relaxing the criteria, and through what ways can patients get the medication? And about the injured dancer, what exactly are the exceptional arrangements for his parents who come from overseas, and will they be taken from the airport to the hospital directly, and do they need to do any days of quarantine at all, or maybe completely exempted? Thank you.
I will answer the exemption first. I think this is not an exception. This is a special arrangement for any overseas passengers who have a real need to go to the hospital, or sometimes some people may need to attend a funeral or something. So after they arrived, if they have completed the initial tests and procedures, they can arrange to go to the concerned places as soon as possible.
Okay, so for the new arrangement of the oral antiviral medications, so the arrangement will be that for those who are under 60 years of age and who are at high risk of medical illness, and for those who are suffering from chronic illness, if they have symptoms within 5 days of their 5 days and 6 medical attentions, and if they don't have any contraindications to the antiviral drugs, all of these patients will be included and can be being prescribed of the antivirals. So the reason for relaxation of this indication is that we know that the earlier the better to have this antiviral, because it helps to lower the viral load, and also it will help to shorten the time from getting the test results to negative, and the patients can recover better. And for those who can get this medication, there are various channels. Previously, we have already said that we have the designated clinics, so the patient can be presented physically to see the medical extensions so that we can prescribe the antiviral drugs. The other way is to book our telemedicine, and through this, we will prescribe the medication and then send to their home right away. So there are various channels for our patients to get the medication. Besides, they can seek the private practitioners or even private hospital. For those appropriate patients, they can be prescribed with the antiviral drugs.
下一題，右手邊前排黑色。
The one at the front in black. I'm from Mingpao. First, a question for Dr. Chuang. You mentioned about compassionate arrangements for arrivals. Would there be certain criteria, say for example point-to-point transportation? After visiting the hospital, do they have to go straight to a quarantine hotel? How many such cases have already been approved? And a question for Dr. Kwan. Relaxation of prescription of COVID medications. High risk, can you give us some examples apart from those with chronic illnesses? If someone has no symptom, would they be prescribed medication? And those under the age of 60, high-risk groups, do you have the percentage of critical conditions as well as fatality? For the 22-month-old girl, you said that her condition is critical. What is the current treatment? So what is the illness suffering by this girl? Acute necrotizing encephalitis. And what about serious cases? Any sublineage? Is it BA4, BA5? Have you seen any serious cases from these sublineage?
Usually, during quarantine, if there are special conditions or requiring the persons concerned to go to a special place or to a hospital, there are special arrangements. There is point-to-point transportation. Usually they have to return to their quarantine hotel afterwards. For high-risk groups, we all talk about those with, for instance, hypertension or obesity. These can be risk factors because they can easily lead to complications. Of course, each patient's condition is unique. So if a patient is confirmed and he is asymptomatic, but we have got different channels, such as our support hotline, they can call us. And through communication with our colleagues, well, the patient may consider himself asymptomatic, but he may be a high-risk person, and we may advise him to take medication. Of course, he may want to know whether there are side effects of medication and whether he is taking other proprietary medicine or Chinese medicine. And so we have to discuss with the case. As for those under 60 and in serious condition, I don't have such information with me. I can supply it later. And for the 22-month baby girl, because it only happened yesterday, some investigations and examination is still in progress. She needs ventilator and also cardiac tonic to support her organs, and we will look at her response. As for cases of children, I don't have such information with me now. I will see whether I can supply it later. We haven't noted a particularly high rate, but for the 22-month baby girl, we will do sequencing to consider the sublineage. The lady in white. I'm from independent media. Dr. Zhuang, can you say in Cantonese once again? What compassion arrangement will be provided for the injured at the concert yesterday? And upon arrival at our airport, does that mean that only RAT negative is required and then there is no need to wait for 7 days of quarantine? Well, upon arrival in Hong Kong, the initial testings will be administered, and then check into a hotel, and then arrangements can be made for a prompt visit to the hospital, and some may come back for a funeral. So we do have such arrangements. Any other questions? So the press briefing ends here. Thank you very much.